I was prescribed it around 15 or 16 here at a local chiropractor's office. Me and my dad were preparing for a softball game in the backyard, and I broke this bone right here underneath my eye.
Crystal Songer remembers her first prescription for opioids.
And he prescribed me Oxycontin 20s, and I fell in love from there. It was like a warm, fuzzy blanket. So I kind of continued from there, from that doctor on to another, up till I was 18. And I just kept a constant prescription. When I finally hit my rock bottom, I had lost my home. I was living on a riverbank. My husband was being arrested. I was getting food from a food bank that was maybe expired, maybe not. I was having to take showers in the river. I was scared I was going to overdose and nobody was going to know where I was. When I found out that I was going to have another baby, I decided, this is it. You can't keep doing this. You can't keep living this way. You have lost so much money and so many people. If you don't change now, you'll probably die. I asked a friend to take me and drop me off at a rehab.
The first intervention that is needed is to help someone get through the withdrawal period. So we try to introduce individuals to Suboxone as quickly as possible because at that point they feel absolutely miserable. It's like the flu on steroids. They have diarrhea, they're throwing up, they're aching, their bones sometimes feel like they're shattering, they feel terrible. If someone can get Suboxone, about a half an hour, 45 minutes, they already start to feel better. I don't think that the community was prepared, and I don't know how you would prepare for so many people to be ill. In 2020, we lost 56 people in Martinsville, Henry County area, and those are our neighbors. Those are our loved ones. The school system, because there are so many people that are in active use right now, the children need some extra care and attention, making sure that they are getting their needs met. We also have folks that live in some tent communities where they've lost housing, they've lost their jobs, and so they don't have any resources. And so we're trying to help folks that don't have shelter, don't have food, don't have clothing.
Crystal Songer is there helping as well, now a peer recovery counselor, advising people who might have arrested her in the past and sitting with people who are trying to get clean, as Crystal is today.
I know how bad they feel when they're waiting to talk to somebody. And if I can get them out of withdrawal so they don't walk out of our office and use, I'm changing lives. Every time I go into that ER and share my story, or I'm sitting in that next room sharing my story, and somebody says, I was going to use the other day, but I thought about you. And I'm like, wow, that touches me.
Stacy Hicks is living a changed life today as well. Collecting litter and cleaning up at the courthouse are jobs she's thankful to be doing.
When I got in trouble with the law, I was worried about how much time I would get, if my family would be mad at me.
She's one of hundreds of people in her county serving time for drug convictions by going to work instead of going to jail.
The Russell County Community Work Program allows nonviolent offenders to spend their incarceration on a work crew out working in the community instead of being incarcerated. Well, it saves the county a ton of money on housing inmates. It saves the county on work, like the trash sites, the animal shelter, paint buildings. One year it saved $1 million in work costs. When I first came here, I came from a county that didn't have a work program. And in the beginning, I'm like, well, I don't know about this. But it changed the way I think about it, to be honest. This program has changed the way I view drug abuse. You get to know the people who are in the program, and you look at them differently. And it gives them a second chance to give back to our community, which to me is a win-win.
When we first started this program, it was hard to get people to buy into it. People want you to be hard on crime. And all I could say about that is they need to be in the work program one day because there's nothing easy about it. Some of them still live at home in their bad situation. I don't know how they do it, going right back out to that issue. But they stay sober. They do everything that we expect of them, and they don't have an issue with it. They're thankful to be home.
Missy Carter coordinates Russell's work program, as well as the county's drug court, which emphasizes treatment over jail time. Carter says she's learned that treatment and mental health care are both essential for every person dealing with drug abuse.
I think in late 2017, we met with Wise County and helped them, gave them all the things that we had stumbled upon. And they started a program which has done great. And since then, we've helped about 7 other counties. Most recently, Washington County just started a program, got their first people sentenced last month. So it's pretty exciting.
Wise County started its Wise Works program in 2018 and reports that so far, they've saved nearly $3 million through decreased incarceration fees and increased help at work sites. In Russell, Stacy says,
Yes, I think every county should have a program like this. I mean, it really helps people. My family's proud of me. I'm proud of myself. I've been clean 17 months. I have a better relationship with my daughters. The program has changed my life because I'm around positive, clean people. I get to clean the courthouse. I get to pick up trash every day, be outside. Then I get to go home and be with my kids.
Virginia's Department of Health says opioid overdose claimed the lives of 4 Virginians every day in 2020, and the pandemic has made abuse and overdose much worse. Opioid abuse has become even more treacherous because of drugs being laced with deadlier fentanyl and some users transitioning to heroin or meth. The state is just starting to receive funds generated by legal action against drug companies for the ways they manufactured, promoted, or distributed highly addictive and potentially lethal opioids.
We got a $500 million settlement that is coming to Virginia, one of the largest opioid settlements in the country. That money is going to go to the localities, so we're hearing from localities what are some areas we could put resources in. We have the Opioid Abatement Authority that's headed up by Senator Pillion, which my office will be advising legally on. And so a lot of it is getting money to the localities, what are the best practices, so they can actually do the best treatments, because at the end of the day, we all want the same goal. We want people.
This abatement fund may total hundreds of millions of dollars for prevention, treatment, and recovery from opioids and the massive collateral damage they've caused throughout the state. At Virginia Tech, researchers are hoping for a scientific way to limit opioid damage in the future.
Our vaccine obviously is against the different opioids. Right now we are working on vaccine against the oxycodone. We hope we can extend that to the vaccine against the fentanyl. That's the mostly overused drug on the market right now. We have worked on the similar technology against nicotine. We thought use this approach can help the people they want to stop using the opioids. That will help them to become sober.
With innovations from science, law enforcement, and the treatment communities, as well as monetary infusions from government and legal settlements, Virginia communities are working hard to recover and to heal, one family, one person at a time.
I would be lying if I didn't tell you I didn't have triggers or if I didn't think about using, but I know that that's not an option for me anymore. I have an amazing life. I have a home, I have 2 vehicles, 3 beautiful kids that live in the home with me, and a relationship with my oldest that I'm trying to gain back one day. I feel like I'm giving back, and all the bad that I put out there in the world will eventually be erased.
There we go. Next one. Next one. All right, cross Sissy, cross it.
Thank you for watching. Continue to follow Virginia news and stories by subscribing to our VPM YouTube channel.